So, and then I would say the other super important thing for nurses to know about is the medicine is safe, but it's not without its side effects and adverse effects, right? So there are certain populations that likely should not be using cannabinoids, and usually it's the THC that we worry about. And so, but sometimes it's the CBD. So if patients are on, excuse me, a blood thinner, um, they should be really cautious. And, if they're on a medicine that they need an INR checked, it should probably be checked, as scheduled because it can cause some issues there. Anyone with cardiac disease, again, being really cautious, maybe very low or no THC, but again, there's so many other cannabinoids that they could benefit from. A side effect of THC is tachycardia. So we would want to be just real cautious with cardiac patients. There is also some data, it's kind of mixed about potential for having a myocardial infarction, particularly in men, goes up around that hour or so after they've inhaled cannabis. So, it's mixed data still. There's also, though, data to show that cannabis can be really good for the cardiac system. So, again, one of those areas that we need to research. Pregnant women probably should not use THC. That's pretty much the recommendation that's out there. And we still just don't know enough about the other cannabinoids. So it is somewhat risky. On the other hand, are women using cannabis when they're pregnant? Yes. Why are they using it? Because they feel like crud, because they have hyperemesis gravidum. It's tough being pregnant. And then we would really want to, if they're going to use it, we really want to support them in a harm reduction way, using the very smallest amount possible, and seeing if they still would need it over time, because people are going to do what they're going to do. Of course, my official stance is like, don't use it when you're pregnant, right? Because that aligns with all the professional guidelines. And then I have this realistic stance of like, people are going to use it. What are we going to do to support them to use it, as safely as possible with the lowest amounts of THC possible? Children. So children, if there's a medical need, like there's some good data to show that kids that are getting chemotherapy will do much better if they use some cannabis and they have that palliation, and they're able to sustain getting their full treatment instead of quitting earlier. But if there's not a medical need, and a lot of kids will turn to it because they have anxiety, social issues. It feels maybe safer than alcohol, which it is safer than alcohol. Nobody's ever overdosed on cannabis that has led to deaths. Now, there are other ways that may be associated with deaths related to cannabis, like someone gets cannabis hyperemesis syndrome and they can't stop throwing up and they dehydrate and go into organ failure. That's kind of the main thing that I see with leading to a death with cannabis use, but you can't technically overdose with it.
It sounds like a lot of the side effects and cautions about cannabis, as well as the benefits, all are individually dependent on the person who's using it, their nervous system, how their nervous system interacts with the cannabinoids. Because I can see how you can have like anti-inflammatory effects are great for your cardiovascular system and your heart and da da da. But if you have the nervous system that THC will increase and you're putting an extra load on an already taxed heart, then so it's really,
it is
you got to play with yourself.
it is really individualized.